So patients presenting with pain in the neck is very common in your surgeries, and very often the pain in the neck will be accompanied by pain in the arm. So when you've got a patient presenting with those sorts of symptoms, you're going to need to examine the neck and the movements of the neck, and also to do a neurological examination of the arm. So I always start by looking at the patient's neck. I'm looking for the alignment, how he holds his head, and whether the normal cervical lordotic curve is present. I then look for the muscles, looking for spasm, particularly in the muscles, and you can also feel for that. And having done that, I then palpate, and I'm looking for tenderness. So I press over the spinous processes, and then I also palpate deeply in the muscles, again looking for tenderness. We'll then get Tom to turn around now and face the camera, and then what we want to do now is look at all the movements of the neck. So we'll start. Tom, can you just look down and put your chin right down in your chest? That's flexion, and then I want you to look up at the ceiling and far back as you can, and that's extension. Then if you look straight ahead of you, Tom, if you look to the left side, so that's rotation to the left side, and then look to the right side, and rotation to the right. Look straight ahead, and then I want you to just tilt your head to the side. This is lateral flexion. Try to put your ear as close to your shoulder as possible, and then the other way. Good. So that's looked at all the movements of the neck. Now, as you all know, there's often a big overlap between neck and shoulder problems. We're not going to cover the shoulder in any detail today, but very briefly, what I do with my patients who present with neck pain is also get a very quick feel for how their shoulders are working. So can you just put your hands behind your head, like this, go over the top, just to scratch your back. Okay, and then come back around the other way, and push your hands as far up your back as you can. So by doing that, we've looked at active movement of the shoulder, and if you just turn around for us, Tom, if he can put his arms all the way up there, and then go back to your original position from the top, go around and put your... then that's a very quick way of illustrating that the shoulder has a full range of movement. And it's important to exclude the shoulder as the source of pain in this group of patients.